Dr. Don Hayes. You're listening to 95.9 WATD. Once again, I have the pleasure and honor of having Maria Iacozza, who is a Reiki practitioner, a natural and holistic integrative medical practitioner in our studio tonight. And before the break, Maria, we had a really good discussion about patients and ourselves, for, using ourselves as examples, about exploring treatment options, doing your homework. We spoke about regaining health as being a project, much like any other important task in life as a project. But we started to talk about something that I want to make sure that we finish, and that is that we're not talking about, when we talk about integrated health, we're not talking about working outside necessarily the blessing of a primary care physician. Now, I also, before the break, mentioned my experience, as did you, with some wonderful medical practitioners. And that's one of the points that I want to make, is that, I tell patients in this day and age that you should be completely comfortable with your physicians. If you're not, please find somebody else.
Right.
And that's really should be rule number one, because if you are uncomfortable having a frank discussion about treatment options and so on and so forth, because the bottom line is that any good medical physician is going to tell you that if the treatment is helpful and not harmful, you have my blessing. And that's almost universal. They're also going to tell you if they think something could be dangerous to your particular circumstances, they're going to speak right up and let you know. But assuming that a patient has an excellent primary care physician or primary care physician's office to work with, let's talk about some of the next logical steps. And as you say, having patients explore options. Now, this is something that really, in my clinic I find irritating, because I'll have patients come to me that we ultimately help that have done all the invasive things first. They've been at the pain center, they've done all the shots, they've done radioablation therapy, they've done narcotics, but yet they haven't done the things that are non-invasive, inexpensive, and might have helped them from the beginning. So we're talking a little bit about kind of doing the homework on the part of the patient and then reversing that whole process.